Assalamualaikum warahmatullahi wabarakatuh. My name is Aida Akilah binti Muhammad Arshad, matric number 066327, and we are from Group 3. We'll be presenting about live animals or livestock zoonoses. For introduction, most humans are in contact with animals in a way or another. A zoonotic disease is an infection or disease that can spread naturally from vertebrate animals to humans, or from humans to vertebrate animals. More than 60% of infections that affect humans are zoonotic. Zoonotic diseases are a major global threat to public health and animal welfare. This covers a wide range of pathogens, including bacteria, viruses, fungus, protozoa, parasites, and others. The emergence, re-emergence, distribution, and patterns of zoonoses have been significantly influenced by a number of causes, including climate change, urbanization, animal migration and trade, travel and tourism, vector biology, anthropogenic factors, and natural factors. Next is the type of livestock zoonotic disease. When looking at alternate method for control, the principal epidemiological classification based on the zoonosis maintenance cycle is essential. This categorizes zoonoses into 4 groups. First is direct zoonoses. They are transmitted from an infected vertebrate host to a susceptible vertebrate host via direct contact, fomite contact, or mechanical vector. Second is cyclozoonoses. They require more than one vertebrate species but no invertebrate host to complete the agent's life cycle. And the third one is the metazoonoses. They are zoonoses that complete their infectious cycle in both vertebrates and invertebrates. The infectious agent multiplies based on propagative or cyclopropagative transmission, or simply develops in developmental transmission in the invertebrate host, and there is always an extrinsic incubation period in the invertebrate host before transmission to a vertebrate host. And lastly is the saprozoonoses. Saprozoonoses have both a vertebrate host and inanimate developmental site or reservoir. Non-animal stuff such as food, soil, and plant is considered the developmental.
Hi, my name is Ifa Afika binti Muhammad Yusri and my matric number is 065951. Following this, I will discuss some zoonotic diseases that are connected to ruminants. Even though there are numerous zoonotic illnesses related to the ruminants, I will focus on leptospirosis and Q fever only. So what exactly is leptospirosis? Both humans and animals can get leptospirosis, a bacterial illness caused by pathogenic helicosporosis of the Leptospirogenus family of Leptospiraceae. It can affect a wide range of animals, especially livestock animals, including cattle, sheep, and goats. As a zoonotic illness, leptospirosis can spread from humans to animals. The bacteria, which are normally excreted in diseased animals' urine and can persist in water and soil for months, can cause an infection in humans. Unintentional ingestion, contact with tainted placenta, urine, and fetal tissues are the main ways that people contract the virus. In addition, consuming contaminated food or water, touching contaminated ground, or coming into contact with the virus can all contribute to the spread of the illness. The bacteria can enter through cuts in the skin or through mucous membranes in people. A bacterial infection called leptospirosis affects cattle in particular and can lead to anemia, liver and kidney illness, as well as problems with reproduction. Abortion and poor newborn calf are the most prevalent clinical symptoms in cattle. A wide range of symptoms, including high fever, headache, chills, muscle aches, vomiting, jaundice, red eyes, abdominal discomfort, diarrhea, and rash, can be brought on by leptospirosis in people. In more extreme circumstances, it may result in death by hemorrhagic pneumonia, liver failure, and kidney failure. Leptospirosis occurs worldwide but is most common in temperate or tropical climates. It is an occupational hazard for many people who work outdoors or with animals, such as farmers, slaughterhouse workers, veterinarians, and animal caretakers and dairy farmers. Okay, now let's move on to the next disease called Q fever. What is Q fever? Q fever is a widespread disease caused by the bacteria Coxiella burnetii, which is able to infect mammals, birds, reptiles, and arthropods, especially livestock animals. It causes a mild disease in ruminants but can cause abortions and stillbirth in cattle, sheep, and goats. It is also a zoonosis, a disease of animals that can infect humans. Coxiella burnetii is shed in male urine and feces, but most importantly, during parturition, huge concentration of bacteria, up to 1 billion per cubic centimeter, are found in the amniotic fluids and the placenta. Outside the animal, the bacteria becomes a small, dense, long-lasting spore-like form which is able to resist heat and drying. It can then contaminate dust and be spread by wind for long distances. It is so highly infectious that a single inhaled organism can cause clinical illness in an animal or person. Outbreaks typically occur following a birth or abortion when the environment becomes contaminated with the birthing fluids. Q fever can also be spread by ticks, which pass the bacteria from an infected to a susceptible animal and whose feces contain the bacteria, thus also contaminating the environment. Since it is also shed in the milk of an infected animal, it can be contracted by drinking non-pasteurized infected milk. The risk groups for Q fever include veterinarians, laboratory workers, farmers, and abattoir employees due to its high human transmission risk. Numerous livestock handlers have antibodies that indicate exposure to the pathogen. Fever, extreme exhaustion, chills, sweats, muscle aches, sensitivity to light, severe headache, nausea and vomiting, diarrhea, cough, chest discomfort, stomach pain, and rash-like areas under the skin are some of the clinical indicators in people. The main clinical symptoms of Q fever in ruminants are reproductive issues. These include metritis, mastitis, infertility, stillbirth, and abortion. Animals who are not pregnant usually exhibit no clinical symptoms. Identifying Q fever presents a challenge since animals can exhibit no symptoms of the illness while still shedding the bacterium. Serology can be used to test plots and herds for Coxiella burnetii. PCR or immunohistochemistry of placental lesions can be used to screen specific animals. PCR can be used to test feces, milk, and birth products since the germs are so dangerous and there is a risk to lab workers. Culture is rarely employed for diagnosis.
Assalamualaikum and hi, the given name is Alina Jabbar binti Ramli with the matrix number 066791. For now, I'm going to explain a little about few diseases in poultry that are zoonoses. First of all is the avian influenza. About the diseases, avian influenza or bird flu refers to the disease caused by infection with avian influenza type A viruses. Avian influenza is a highly contagious viral disease that primarily affects birds, including domestic poultry. However, certain strains of avian influenza, such as H5N1 and H7N9, have been known to infect humans, leading to severe respiratory illness and, in some cases, death. Effect of the disease on animal and man. Effect on the animal is the impact on animal health, including wild birds, often considered mainly as factors of the disease. Wild birds, including endangered species, are also victims. The consequences of avian influenza on wildlife could potentially lead to a devastating effect on the biodiversity of our ecosystems. Sudden death with no prior signs, low energy or appetite, purple discoloration or swelling of various body parts, reduced egg production or soft-shelled misshapen eggs, nasal discharge, coughing or sneezing, lack of coordination, and also diarrhea. Effect on man. Illnesses in humans from bird flu virus infections have ranged in severity from no symptoms or mild illnesses. Example given is the eye infection, upper respiratory symptoms to severe disease. Example given pneumonia that resulted in death. Cough, headache, shortness of breath or difficulty breathing, sore throat, fever or chills, fatigue, congestion or runny nose, muscle or body aches. Transmission. Human cases of avian influenza are usually the result of direct or indirect exposure to infected live or dead poultry or contaminated environments. Infected birds have avian flu virus in their saliva, mucus, and feces. Humans can have contact with avian flu virus when a virus touches the surface with the virus on it, then touches their eyes, nose, or mouth. Infected birds can shed avian influenza A viruses in their saliva, nasal secretions, and feces. Susceptible birds become infected when they have contact with the virus. As it is shed by infected birds, they also can become infected through contact with surfaces that are contaminated with virus from infected birds. Next is salmonellosis. About the disease, salmonellosis is caused by the salmonella bacteria, which can be found in the intestines of poultry. Contamination of poultry meat and eggs with salmonella can occur, leading to foodborne infections in humans who consume undercooked or raw poultry products. Symptoms may include diarrhea, abdominal pain, fever, and nausea. Effects of the disease on the animal and man. Most animals do not get sick from salmonella. Animals can carry salmonella and still appear healthy and clean. Salmonella naturally lives in their intestines and can be found in their feces. Most people with salmonella infection have diarrhea, fever, and stomach cramps. Symptoms usually begin 6 hours to 6 days after infections and last 4 to 7 days. However, some people do not develop symptoms for several weeks after infections, and others experience symptoms for several weeks. For the transmission, salmonella is spread by the fecal-oral route and can be transmitted by food and water, by direct animal contact, and rarely from person to person. An estimated 94% of salmonellosis is transmitted by food. Humans usually become infected by eating foods contaminated with feces from an infected animal. Animals get salmonella from the environment by eating contaminated food or from their mothers before they are even born or hatched. Most animals do not get sick from salmonella. Animals can carry salmonella and still appear healthy and clean. Lastly is the Campylobacteriosis. About the disease, Campylobacteriosis is caused by the Campylobacter bacteria commonly found in the intestines of poultry. Handling or consuming contaminated poultry products, especially if not properly cooked, can result in infection in humans. It manifests as gastrointestinal symptoms, including diarrhea, sometimes bloody, abdominal pain, and fever. The effect of the disease on the animal and man. People with Campylobacter infection usually have diarrhea, often bloody, fever, and stomach cramps. Nausea and vomiting may accompany the diarrhea. Symptoms usually start 2 to 5 days after infection and last about 1 week. Campylobacter species causes enteritis, abortions, and infertility in various species. Campylobacter jejuni and occasionally Campylobacter coli cause enteritis in dogs, cats, calves, sheep, mink, ferrets, poultry, and some species of laboratory animals. The transmissions, animals can be exposed to the bacteria by direct contact with sick animals, by ingestion of fecally contaminated feed or water, by licking or chewing on objects contaminated with feces from infected animals. People can get Campylobacter infections by eating raw or undercooked poultry or eating something that touched it. They can also get it from eating other foods, including seafood, meat, and produce, by contact with animals, and by drinking untreated water. That's all from me. Thank you.
Next, I will explain about swine disease. The swine industry is affected by several common diseases, including zoonotic disease, pre-weaning disease like exudative dermatitis and coccidiosis, and post-weaning disease like respiratory disease and swine dysentery. But I will explain focusing on zoonotic disease in swine. The first one is anthrax, a deadly disease to livestock, and occasionally to human. Anthrax is caused by the bacteria named Bacillus anthracis that can form into two ways, which are vegetative and spore. Sudden unexpected death may be the first clinical signs of anthrax in swine. Signs depend upon the site of localization of lesion. Three forms of anthrax based on site of localization are termed pharyngeal anthrax, intestinal anthrax, and septicemic anthrax. Swine with pharyngeal anthrax, the most common form, show marked cervical swelling and dyspnea. They may die from suffocation, and other signs include fever, depression, and inappetence, perhaps vomiting. This disease can affect to human because spores formed by the bacteria can enter the skin through an open wound or abrasion. Figure 2 is show that develop of cutaneous anthrax on the human skin. So how is the bacteria or this disease transmitted? For human transmission, it can be through cutaneous from contact with infected tissues, wool, soil, and biting flies that carries the bacteria, and also gastrointestinal due to the individual consume undercooked meat in slaughterhouse and for lab worker. Lastly, how this bacteria can infected or transmitted among the animal. The bacteria present in hemorrhagic exudate from mouth, nose, and anus. It can be transmitted through oxygen exposure, including in spores form and soil contaminate. Decaying anthrax infected carcass and their fluid can contaminate the soil, where resistant spores are then formed. Most grazing animals ingest the spores while grazing over contaminated soil. Infection of swine usually occurs when they have fed on the anthrax-infected carcass or when the feeds containing large number of spores are fed to them. The sources of contaminated feed is the animal component such as bone meal, tank age, or milk. Zoonotic disease in swine is Japanese encephalitis. Japanese encephalitis is a mosquito-borne viral disease that can cause reproductive losses and encephalitis in susceptible animal species. It is caused by Japanese encephalitis virus, which is a member of the flavivirus genus. The clinical signs in pigs, including adult sows, do not typically show overt sign of disease, but if infected before 60 to 70 days of pregnancy, may either abort or give birth to mummified and stillborn or weak piglet, with some neurological signs. In a previously uninfected population, litters from sows and gilts would be expected to be equally affected. Boars, if present on farm, may experience infertility and swollen testicle. This disease can affect to human, including acute encephalitis such as headache, high fever, stiff neck, and may progress to paralysis, seizure, coma, and death if they have not get treatment. In utero infection possible can cause abortion of fetus. The virus is primarily spread by mosquitoes feeding on infected pigs or some species of water birds, and does not equally spread directly from animal to animal. It is not contagious from animal to animal, animal to human, or human to human. Certain types of mosquitoes can become infected with JE virus, such as Culet species, and these tend to most active at dawn and dusk. Pigs with the infection do not transmit the infection to other animals, but may infect mosquitoes if bitten, while they still have the virus in their blood. So that's all.
Assalamualaikum and hello everyone. My name is Nukamarina Aini, binti Muhammad Nasir with matrix number 066409. So now let's move to my part, and what I would like to talk about is the impact of livestock zoonoses on the economy and human health. As we all know, all farm animals naturally carry a range of diseases, some of which can also affect humans. These diseases are known as zoonoses, and if you work with animals, your health may be at risk from them. Disease transmitted from animals to human can also affect visitors to farm, especially children or the elderly who are vulnerable to infection. Our food system have changed due to the complexity of livestock production and the value chains that are connected to it. These developments have brought with them new issues that are related to zoonotic illness, particularly their effect and the accompanying costs of prevention, control, and surveillance. This negative effect is a result of both direct loss to the animals and public health sectors, which are primarily connected to value loss due to morbidity and mortality in human and animals, and indirect loss, which include the economic costs that resulting from the response to disease and the limiting of its negative effect. The economic costs incurred in the control of zoonotic disease in animals are often huge and additional to medical costs and loss in human work. The additional expense arise from surveillance mechanism for detecting animal reservoir, diagnosis of animal disease, quarantine of animals, restriction of animal transport, inspection of meat and milk, and condemnation of animal products. The impairment of animal production by disease forced many countries to import milk, meat, leather, wool, and other animal products. This drains foreign exchange needed for development. On the other hand, countries which have animals and animals products that could be exported to a foreign exchange may find their markets closed or restricted because of endemic infection beyond the cost of control. Economic effects include direct reductions in household income due to decreased sales of livestock or product, consumption effect due to decreased food security, increased household vulnerability where livestock is used as a risk coping mechanism, and effect on household wealth which affects savings and gender equality. Socioeconomic loss from zoonoses are difficult to quantify completely as with other human disease because the cost of lives and suffering that cannot be measured. Many of the zoonotic diseases cause serious illness and high mortality in man. The effect of febrile illness include loss of food capacity, loss of earnings, clinical complication, interference with patterns of family life, and potential nutrition from increased metabolic demands in people who are already poorly nourished. In addition to clinical effect, the presence of zoonoses in community has economic repercussions as a result of the need to provide health services. For example, hospital, diagnostic, and other laboratory service. The loss of human efficiency and man hours together with medical costs of control in zoonotic disease affect the national economy severely. Zoonoses also undermine animal health and productivity, reducing the production of food,
as well as the work output of animals. This can contribute to human malnutrition and to lowering the resistance of large number of people. Direct costs of zoonoses associated with livestock production relate to loss due to morbidity and mortality in food-producing animals, which lead to a decrease in the expected output due to disease, treatment costs, and the increase in expenditure on non-veterinary resources. Morbidity and mortality of animals due to zoonotic disease carry also other laws that related to the wider social, cultural, and economic value of animals and their health and welfare to people.
The most efficient and economical method of treating disease is to prevent infections from entering and spreading across the livestock populations. Even while various disease-specific management strategies exist, tighter control over livestock movement can offer broader protection. Because of the connection between people and animals, it is important to be aware of the common ways people can get infected with pathogens that can cause zoonotic diseases. Workers, especially the individuals that are prone to livestock zoonoses, since they are the closest persons with the animal itself. And related to this, individuals should take part in preventing livestock zoonotic disease by taking care of personal hygiene. First, many germs are spread by not washing hands properly with soap and clean running waters. Workers can come in contact with the livestock animals at the farm. Hence, it is important to always keep the hands clean. Wash hands right after handling the livestock. If soap and water are not available, use alcohol-based sanitizer that contain 60% alcohol and above. It is one of the most important steps to take in avoiding from getting infected as well as spreading this germ to others. Second, eating or drinking is strictly prohibited in the animal housing area. The next step is focusing on environment maintenance at the farm. First, take a very good care of the cleanliness of the feed and bedding from floors. Litter attracts vermin, which can introduce a zoonotic disease into the facility. The feeds can be contaminated with feces, and the disease can be transmitted via fecal-oral. Second is, having a proper ventilation protects the animal and worker. It is the most crucial part since a good ventilation system controls the temperature and humidity, removing the gas that may contain pathogens which are harmful to the animals and humans. Now we are focusing for the animal itself, which is the livestock. For the livestock, steps that can be taken to prevent the livestock zoonotic diseases are by selecting a well-known, reliable sources from which to purchase animals, one that can supply healthy stock, inherently vigorous and developed for a specific purpose. The owner of the farm should be aware that animals that were bought for a cheap price is not necessarily having a good quality, and they could not just take that risk. Second, the vaccination for animal must be done precisely according to the schedule for each herd and flock and maintain a good record related to herd or flock health. If there are sick animals, observe it frequently for signs of disease, and if disease problem develops, obtain an early, reliable diagnosis and apply the best treatment, control, and eradication measures for that specific disease. Spreading awareness to the community is important to open the community's mind about how fatal and dangerous livestock zoonoses can be. For instance, among farmers that are informally educated and illiterate, the awareness of these zoonotic pathogens are limited. Several farmers reported high-risk practices despite being aware of the zoonotic diseases, suggesting a disconnect between the farmers' awareness and practice. Hence, this is the job of the government, such as pharma, to brief them with the zoonotic disease prevention program to improve the understanding of risk and damage that can be caused by livestock zoonotic diseases. farmers can get the input about how to prevent zoonoses by practicing the prevention steps that were taught to them. Another step is the media, the government, and animal science students all have a responsibility to inform the public about the zoonotic disease that can infect animals and spread through a variety of sources. The responsible party participated by giving a public lecture to raise awareness of livestock zoonoses and teach the public about how to avoid contracting and spreading them.